my
So it's more
tray.
about, for the return demonstration, talking through and saying this is what I would do as opposed to actually opening things up.
So you go ahead and lubricate, just kind of toss that in, okay? The next thing I can do is I can put my my syringe on the end of my catheter, okay? So you don't have to take it all the way out yet, okay? So the next thing I'm going to do is I'm going to take this blue cover off of my catheter because I need to do what with my tube?
Test it.
I need to lube my tube, right? Okay, so sometimes you can't get that all the way in, that's fine, okay? So I go ahead and lubricate my tube. Okay, I can either keep it there or I can put it back in. I'm gonna put it back in, okay? Just in case, okay? Now I'm ready to do what? Now I'm ready to clean, okay? So I'm gonna spray it. Now this hand is not sterile anymore, okay? So I'm gonna take my wipes and I'm wiping on the inside, not over here, in the inside, okay? The furthest away from me first, okay? I'm gonna get another one, go from top to bottom, and the next one is gonna go down where? Down the center. And in some of these cases, you do have more than 3 cotton balls. You can use more if you like. Okay, so I'm IDing where I need to go. If you felt like you didn't have enough light, what are you gonna do? You're gonna have to start all over again. You're gonna have to get somebody maybe to shine a flashlight. Okay, but when you're in there cleaning, you should have ID'd where you need to go. Okay, so now I'm ready to do what? Insert my catheter, right? And what am I gonna tell my patient as I'm inserting my catheter?
Take some deep breaths.
No, she's gonna bear down. She's gonna bear down as if she's gonna use the bathroom. Okay, so I'm gonna tell Mrs. Dobbs to take a deep breath. Take a deep breath and then bear down. And if this is a female, how many inches am I gonna go in? About 3 to 4. Okay, all right. So I'm seeing urine, and then I want to push 1 to 2 more. Okay, then I need to stabilize it, and then I'm going to go ahead and inflate my balloon.
So you wouldn't test the balloon first?
No. The reason why we don't test the balloon anymore is because sometimes we don't get all the water out, and it could cause some irritation to the meatus. Okay, so you pull back. You don't need to be sterile anymore, right? So with this particular bag, it does have a clamp for you to clamp it on either the sheet. The only bad thing about that is when the CNA comes in to change the bed, she forgot and pulled the foley out. Okay, so we do like to have a little adhesive right here, or you know that nice little adapter. Now where am I hanging this?
On the bed. But not
On the side of the bed? On the bed what?
On the rail.
Right. Not the rail.
No.
Well, there's like a little thing there.
So,
there's like a little hook.
Some beds don't have these little hooks, these little hangers. So you would hang it on the part like right here, where the bed, when you roll it up on that groove there. Okay? All right, so you would clean all this stuff up. And you always want to come back and monitor whether you see any urine. And you also want to describe how much urine came out, what it looked like, any odor. Okay? So now it's 10 days later. All this stuff is gone. Okay, it's 10 days later. And now I need to do what? So just, I can take that out. So now I need to take it out. I have an order to DC it or discontinue it. Okay? So what do I need to discontinue it?
You need a syringe.
So I need a syringe.
You want to check the order to see how much was used to inflate the tube or the balloon?
Yes. So you need an empty syringe. I usually get about a 12 cc. Okay. Usually with these, it'll tell you on here how much was in there, and it was 10. Okay. So I just get a little pad. You don't have to be sterile. Regular gloves. Okay, put the pad under them. I still want them almost in the same position. Okay. And what did we say we was gonna do first? So we need a little alcohol wipe to clean that. to clean this, and then we're gonna attach this, and then we're gonna pull back. We will not be squirting this in the bed like she did on the video. Okay, that's why I said get a 12 ml syringe. When you meet resistance, you know the balloon is deflated. Okay, you'll meet resistance. Okay, and you just twist it off. Okay, now we're ready to remove it. So what are you going to tell your patient? To take a deep breath. And you're going to wrap this around. And why am I wrapping this around?
To secure it. So you don't slip.
Because it came from out of them and you want this flopping all around. Okay, so you have to have control of this. Okay, it's really soft. It isn't like the one that you would use for a straight cath. Straight cath is really hard plastic. Okay, so you want to document what was on the catheter, that it came out with a tip. Sometimes doctors will ask you to cut the tip off and send it to the lab. Okay, they just want to make sure that there's no infection in there. Okay, all right, and then you can take a washcloth, or like she had the little wipes in the bag, the little bath in a bag. You can use those to wipe, to clean the patient, make them comfortable.
Would
Okay.
you ask them if they prefer to clean themselves, or?
Yes, you could. You could. But on the on the video it did say that she did wipe up everything. So yeah, you can ask them to do it themselves if they feel comfortable. Okay, so you just get rid of this.
You would
and
use the same position. You would put them in the same position as when
Yes.
you inserted.
I would put them in the same position.